Okay, it is a coronavirus. They 379 and we have 2,169 cases in the 2,000 still. High chance of us ending up in wave 3 of coronavirus. So 682 high cases are from Toronto, 379 from Peel Region, 254 from York Region, 129 from Ottawa, 123 from Durham Region, and 122 from Hamilton. So Durham Region and Hamilton is sort of neck and neck, and so there we have it, the Danger Six. I ain't going to call it the main six or the big six, because these cases are high. This is usually higher than usual, and yeah, and we could be like possible chance of having to resort to a lockdown, and yeah. So all other regions other than the Danger Six reported under 70 cases. So 12 deaths have been reported today. Okay, you know what? I hate talking about this topic, but UK variants. So the UK variant is almost at 1,500 at 1,494 cases, a plus 36, 60 South African variants, plus 9, and 58 Brazilian variants, which is a plus 4. Okay, I am looking off the CBC news. So the Ontario, some research the table members for the province by Ontario, which is expected to be made public early next week, is based on an analysis of Ontario hospitalization death data between December and March. So the coronavirus variant deaths. So the issue is so what can happen is so variant cases increase the risk of serious illness when compared to an initial strain of the regular coronavirus, which includes 60% of increased risk of hospitalization, 100% increased risk of being admitted to an into ICU, and 60% increased risk of death. So yes. So, but anyways, UK variant, that is the most dangerous thing out there right now, which is the first identified in southeast England. There we go. There we are. It's in the southeast. So so Dr. Barrett said clearly these variants are more transmissible, so you're more likely to become infected if you're more exposed to the virus, and also if you're more likely to be admitted to a hospital and to potentially die from the infection. So she said it had nothing to do with your like age or pre-existing medical issues. You could, yeah. And of course, with the UK variants, so it's important that people need to get vaccinated quickly, and of course there's an issue with the coronavirus cases and variant cases, most affecting the age group 20 to 39. And the second is 40 to 59, and then yeah, and then 50 and 60 to 79, and then it's sort of tied for anyone who is at 19 and under, or 80 and plus, 80 plus. Because if these variant cases so these variant cases can cause serious illnesses and deaths in so some doctors of so some people have doctors have done the research. Dr. Andrew Morse, who is a doctor at disease specialist at Toronto's Mount Sinai Hospital Health System, and of course it's important to focus on how and infectious disease specialist Dr. Gerald Evans, and a professor at Queen's University, said of medicine, said without restrictions in place over the past few months, Ontario may have fared far worse. So we could have, in terms of serious cases and deaths, so which means coronavirus cases could be really going through the roof, 4,000 ish. per day, and and there's one thing now. There's what the issue is right now is since you know how we went back to color zones right after lockdown and such, and that was a big mistake. So many professors, doctors, so Dr. Peter Juni has talked about this, and yes. But anyways, Dr. Andrew Morris said that yes, it's hard for people to continue just to be holed up in their homes. Perhaps the right thing to do is just encourage people to spend as much of their time outdoors as possible. But however, that's not enough. But people not when. But there's an issue with when people with having people outdoors. So, as reported after color zones, as we return to color zones this year, what happened was people were not following coronavirus safety rules, and post-secondary students were having parties. So this happened at Fleming College, Trent University, Western University. Well, they didn't follow the rules. Wilfrid Laurier University, Queen's University. Yes, so. And some cases were most of them were coronavirus cases, but some so at least 30 to 40% of those cases were UK variants, aka which means it's more strict or more dangerous and more contagious, and they could affect more people, and these people need to be put in quarantine and quarantine themselves for 2 weeks. Make sure they don't have any symptoms. They do not interact with anyone, and only go. So I am looking up some stuff I found yesterday. So we need to put more stricter restrictions and stuff. As a reminder, Dr. Abdu Shawkawy reported increases of look what happened to Thunder Bay. The Thunder Bay area, they got put in the gray zone for a reason, because cases were getting out of control, and And Dr. Peter Juni did say we will have 2,000 plus cases in the coming weeks. Look what happened. We're in those that time period. So yeah. And the issue is lack of vaccines. And of course, if we're going to have people, go out and ease these restrictions, just look at the numbers of the dangerous six. So yeah, that can happen like right now, and So, I think we need to resort to another lockdown or something. Because honestly, it's just. If we can't get these coronavirus cases under control, and especially the UK variants, so the coronavirus cases that's at 2,000, over 2,000, UK variants are almost at 1,500. Yeah, it's like 506 away from from catching up to the official coronavirus cases. Yes, this is crazy. So yeah. So I am down with against easing restrictions any further. Cause look where it put us. Hospitalizations. 913 people are hospitalized with the virus. Plus 19. 359 in ICU, plus 27, and 215 of them using a ventilator, plus 3. Yep. Students, oh god. As if it can't get any worse. So we have cases at school related cases at 12,017. 800, this is coming from 1,053 schools, 8,883 students, 1,978 staff, 1,156 unknown individuals. That number has not changed. So 44 schools are currently closed right now. Long-term care home death is still at 3,753 deaths. It's almost a week now, I think. 45 outbreaks right now, so that's a -1. Okay. So yeah, please follow coronavirus safety rules and regulations and color zone rules. Do not have any parties, especially don't do it in large numbers. Yes, you'll be making it worse for the entire town or city, depending where the post-secondary your institution is, or if it's just like having a party and you're not a student or anything. But yeah, if you have a party, you're ruining it for a lot of people right now. For shame, for shame. In a few days, most likely, we will be entering wave 3 of coronavirus. UK variant cases will beat the average coronavirus cases, and we'll be all in hell and there will be another lockdown. Definitely, yes. And we should not be easing stuff just to make things easier for people. We should make things serious. Dr. Peter Juni and Dr. Abdu Shawkawy both said, we need to really do not take this lightly, and cases need to be under control, or it could get even worse.